Very good evening and welcome to this session. Uh, welcome, first of all, let me welcome the speaker, Mr. Nitin Chandran. He is the CEO of MedPiper. We have associated with the MedPiper Technologies, IRIA. I represent Radiological Association of India, Kerala chapter, as a Vice President. A very warm welcome to Mr. Nitin. He's the CEO of MedPiper. He's based in Bangalore. He did he did his degrees from London School of Economics and Political Science, if I'm right. He's the right person to tell us about what is in store for us as doctors and radiologists in India and also globally, because he has a wide experience across the country and also globally. Welcome, a very warm welcome, Mr. Nitin. I also welcome Ashwin Alexander. He's our own teammate in IRIA Kerala chapter. He's an executive committee member. He is currently in US. He has got to US and just come back to Kerala for a while. Very warm welcome, Ashwin. I hope he is there. And I welcome other co-panelists who are there. So today, Nitin, we as doctors, we are facing an avalanche of technological innovations like artificial intelligence, modern technologies. So many things are there. So actually, we are sort of baffled, and in many ways, we need to keep up with the pace of technology. As radiologists, it's relatively easier than maybe than other medical communities, but as there are certain many problems which needs to be addressed in the health sector of India, especially regarding there is a mismatch between the requirement of professional health trained professionals. Also they are more concentrated in urban areas, and there is a lack of consultants in health and healthcare in the rural sector. So these are some special problems to be addressed in India. So technology has made it possible for us to take services to even remote places. And another sector where it is like MedPiper is in education, in medical education. You have associated in many webinars for us. So that has during the COVID period especially, it has become possible for us to interact with the cream of the academia, not only in India but also globally, and it's a blessing in disguise, sort of, because we are able to interact and to learn in many ways. Of course, Nitin is the right person to tell us more about this. Without much ado, I invite Nitin to give us.
Thank you, Dr. Rajesh, and thank you for the intro, and thank you, Dr. Ashwin, and the rest of the panel for the opportunity to speak to a set of doctors. So I'll just recapture my profile. Currently, I'm the CEO at MedPiper Technologies. We are based out of the US. The team sits out of India. We were part of something called Combinator. And before that, I was a director of growth at one of the larger mobility platforms in India. Grew them from about 45,000 to about 4 million users. And prior to that, I did a healthcare hardware startup called Ray IoT. We were backed by Qualcomm, moved to the US. Some of our IP got acquired by Apple. It's still there in the US. So if you or any of your relatives are in the US, you can buy the product in Target stores. And so fairly, my experience in London School of Economics, I did a diploma in health effectiveness and policy. My profile primarily is around understanding large, I wouldn't say consumer behavior, large social behavior, and how things like mobility, things like healthcare have, it could be startups or it could be policy levels, how they have had traditionally impacted, and how does the new trends evolve to meet the needs that come in there, right? And as Dr. Rajesh mentioned, tech in healthcare today, you will find everything from health IDs, EHR solutions, e-prescription tools. You will find millions of products across each and everything that you're doing. So in education, as you said, of course, we partner with you, doctors for CME. Then there are platforms like Medversity, which gives, proper diploma courses in partnership with hospitals. So there's a lot of gears that is moving in healthcare in terms of technology. But unfortunately, the downside of what is also happening is you either have a lot of very smart doctors who have a lot of ideas and domain knowledge over where the gaps are, who do not have access to the technology people or, people who can actually build products, versus on the other spectrum, you have a lot of people who are just freshly graduated or, people who have an idea without talking to these doctors or without engaging with patients, going out and building apps. And because of this digital divide that exists, a lot of the actual opportunity gap is lost out, right? And that is why, as much as there has been an effort to drive impact and outreach, there is still a lot more that can be done. And the goal for us at MedPiper is also to ensure that, so I have a small presentation which I'll be sharing with everybody here, but the whole idea is, how do we make technology simpler? How do we make it easier? Like since Dr. Rajesh is in radiology, you have a company called 7C Networks. So you could be a radiologist sitting anywhere in India and you could still do engagements pan-India, right? But with MedPiper, we started with a fundamental question of, can we enable that for every doctor in India? Right? That was one of our first products that we put out there. And over the last 1.5 years, we have, kind of evolved to catering to a larger service basket. For if you're a doctor in India, we give you a much more richer set of solutions and features. But the whole idea is that, what is it that we can build so that, one, we don't involve in a doctor's day-to-day job. They are good at it. They understand it best. We don't act as a lead gen per se, but we enable a doctor or a practitioner to become because basically doctors are knowledge workers, right? The more time you spend with patients, the more engagements that you do, you yourself keep getting better and your value keeps increasing. So as a knowledge worker, what are the right skills and information, tools and information that we can lay in front of a doctor so that they get better at what they are doing traditionally, and they're able to do it faster, they're able to do it much more efficiently, and they're able to drive much more predictable outcomes. That has been the goal in the last 1.5 years. We built a couple of products, as I will explain in my deck. But yeah, that's a brief intro. And I'll just stop here quickly if anybody has any questions before we get into the deck here. Or do we need to cover any other aspects, Soumya?
We'll start the session can take up the questions in the end.
Sure. Just give me a minute. Is my screen visible?
Yes.
Okay. So the whole, there's a lot of noise about digital health, virtual health, telemedicine, and depending on who you are, depending on where you are, honestly, literally where you are placed in the ecosystem, most people's definition tends to vary. So for a person like my dad sits out of Chennai. He's a recovering cancer patient. For him today, telemedicine means talking to the doctor that he normally goes to, right? But for my grandmother who's in Kottayam in Kerala, where even getting proper signal is difficult, for her it's about the diagnostic report which she sends to my dad after the report is given to her on WhatsApp, right? So digital health encompasses a large subset of not just products, but even large what we call service bundles. So you could be an EHR solution, you could be a digital therapeutic solution, you could be the smartwatch. It could be the smartwatch that you're wearing. It could be an Apple Watch or Samsung Watch or a Xiaomi fitness tracker. It could be the health ID that is being generated to you by the government or by third-party entities that exist in the market. It could be aggregator platforms like Amazon today, who's doing Amazon Pharmacy. It could be the social messenger app like Telegram or a WhatsApp, which you use to communicate with a doctor or a lab assistant or even a phlebotomologist. All of these are bits and pieces of what becomes a larger digital health ecosystem. Right? Digital health is not a singular product. It is not a singular feature. The whole reason digital health exists is that there is two fundamental truths. Internet is there pretty much everywhere in the world. The cost of data has gone down. Thereby, this has opened up avenues for, be it doctors or hospitals, there is supply constraint. You only have so much hospitals, you only have so much doctors. So the simplest way to drive impact is to adopt the cheapest channel of communication and make yourself or your service available on it. And that is what truly digital health is. Digital health is any channel, any tool, any hardware, any software that you could be a doctor, you could be a hospital, you could be a diagnostic lab, you could be a caregiver, you could be a platform that gives out, at-home support that you take to engage with the end patient, where post-engagement, you are able to drive some improvement in the outcome. So if you are giving out the same level of service, but at a much slower time, then you are not really impacting anything. Digital health has an impact where you are making something better, and you have been able to use one of the software or hardware layers to drive the cost down. And from the fundamental question, if you're in the medical field, then it comes down to saying, is it going to impact me? There are a lot of doctors and clinic owners as well as practitioners who have felt that things that a very large company, which is one of the larger healthcare companies in India. So now there is a surgery startup who only do surgeries. Earlier, there was a startup that used to enable you get bookings online, right? Today, there's a lot of doctors and clinicians who feel that, they are not being fair to us. They are setting the price. They are they are not driving us local captive audience. They are driving me traffic from Ahmedabad and all, which means that people will never come back to me, right? So there is a lot of ambiguity as well as a lot of apprehension with regards to, if you are a medical practitioner, how does this play out? Is it going to help you? Is it going to impact you from a career point of view? Is it going to, for lack of better words, commoditize you? Or is it going to be something that you can use to support yourself in driving more value for your customer, thereby catering to a larger set of customers, and you then being able to deliver more care, deliver more value, and building up your own brand in the process, right? So in the actuality of the word, what digital health encompasses is there are at least 3 key areas that digital health truly covers. One is the data aspect of it. And data can be generated from everything, as much as if you have a Samsung phone, if you have an Apple phone, if you have an MI phone, today you will notice all of them have health apps, right? It doesn't matter that you are using a wearable device, it is still tracking how many steps you have done. They have something called an accelerometer, right? That is why some phones will tell you that we have fall detection. If you fall, we can track and we can alert your relatives, right? Records like that. What is your standard data? Like, how old are you? What is the kind of food that you order? How many times do you order out? All these can be triangulated in creating what is called social determinants. Who is the person? What does his family look like? How many times do they visit a doctor? How many times do they order food from outside? Then today there are new age solutions where they can send what is called a home genomic kit. They will send you a kit at home, and you can send it back, and they will upload the report digitally. The minute that digital report is created, your data has been captured somewhere, right? And then there are things that you do on social media. If you have put out a post on Quora asking, I have bad throat, and but I have not been in the range, etc. What do I do? Or is this doctor good? Or I ate something which has caused an allergy. What you're doing is you're putting out a lot of data. It could be personalized or it could be generic, but these are data points that are getting generated across different touch points on the internet, right? And then if you have mHealth covers two kinds of app. One is your standard health app that is sitting on your phone. Plus, it could be anybody like a Tata 1mg, Apollo 24/7, Practo, where you can do digital consultation, where you can do, order a diagnostic test at home. And then there is, of course, wearables. So between this, everything from your insurance claim data to your wearables, you're just continuously putting out data of who am I, what is my health like. And that is not just true for you, that is also true for your dependents, right? And this is a lot of data where some elements are super rich in the sense of making assessments. So let's say that I am somebody who is exhibiting early symptoms of diabetes, right? And if I am continuously running every day for 10,000 steps, I'm able to hit the 10,000 steps target. I'm able to run for 2 kilometers every day. I do workout for 45 minutes versus somebody else who doesn't do any of it but orders Swiggy 6 times a week. There are certain inferences you can derive, even if both people have the same conditions, right? But with that raw data, you cannot pull out any tangible information, right? So that is where analytics comes into play. You take all this data and then you put it into what is called an AI engine. It could be an analytics engine, right? And the analytics engine will drive certain patterns. They do not drive judgment. So answering the fundamental question, does digital health have a scope for being a threat for doctors at any point in the future? The absolute answer is no. Digital health is a tool that, if rightly implemented, can be the biggest asset that doctors have to make themselves better, right? Because now, even before the patient walks into your room, if you have access to the right kind of data that has been run through analytics, you will have certain pre-data supported assumptions that you can make. So today, if in a hospital, all you have is check for their BP, check for their weight, and check for any other conditions, tomorrow you can have richer data of did they do a diagnostic test continuously in the last 4 quarters? What did that diagnostic report variation look like? Have they been continuously working out in the last 200 days? Okay, do they smoke? Do they drink? As much as you ask the standard questions, the extra data that comes on top of it will help you as a doctor make much more predictive assessments in understanding the consumer better or understanding the patient better. And using this data, now you get to make much smarter decisions by optimizing costs. So if you know that somebody is doing a workout versus you know that somebody has been not even getting out of their house, you can direct the right person to the right kind of diagnostic report, test requirement. Thereby, for that user, reducing the cost. A. B. Today, there is this general apprehension that, oh, if you walk in, they'll tell me to take 5 reports. Now you're able to personalize it. You're able to say that, look, I understand what your health looks like. And because I understand it, this is what I think you should do. Right. And it is much more personalized. At the same time, it is much more comprehensive. Right. It does not look like it is coming purely from a place where you are busy. It looks like, no, I already have all the data. I've been able to do all the homework even before you came. The analytics engine has helped me say that, okay, certain parts of my triaging, this is how these are the triaging flows that I can take. And based on that, you could be either in the preventive, you could be a doctor catering to preventive, you could be a doctor catering to acute, or you could be a doctor catering to chronic care components. You're able to create clinical guidelines, you're able to create patient journeys on your own now with much more richer data. And by doing all this, what are you doing better, right? What is it that digital health is able to do, which 10 years back doctors were not able to do? Because fundamentally, even 10 years back, people still had health problems. Doctors still existed. The sun still rises, right? So what's the magic? The magic primarily comes to saying that today users are more demanding. And today the biggest headache for doctors is Google. They will go and Google everything. And there is a mind that says that if you Google enough things in health, eventually everything will lead to cancer. right? So customers are coming with more and more, patients are coming with more and more misinformation, right? And unfortunately, certain components of health is getting commoditized. And today, the misinterpretation of digital health has placed doctors, or I would say consultations and diagnostics, in the commodity bucket. Instead of making a fair judgment of saying, is this a practitioner who understands my profile? Because of the broken definition of digital health, as well as a broken set of tools that is available in the market, today the assessment is done fairly on price. Oh, that platform is charging me 99, this platform is charging me 199, the other platform is charging me 499. In 499, I'm getting free medicine purchase, right? The advantage of health is you can't commoditize. Every person is individually unique, right? And the more digital health tools that you start using into your workflows, the more you are able to focus on the patient outcomes, the more you are able to stitch together a better patient experience, right? And you're able to do that because you end up being better informed doctors. So the whole care journey now becomes seamless, it becomes, continuous, and it becomes proactive. You could do, today there are tools, it's actually one of our tools. Today there are tools which enables you, let's say that 5 doctors come into, 5 patients come into your clinic who need continuous monitoring. We have a tool that you can just use and ensure that if they even have, skipped working out for a day, you can proactively say, okay, this is a diet changes, without them having to check in with you or you having to check in with them, right? These kind of advantages. So now the patient feels that, oh, damn, my doctor came to know. So one, there is a whole thing of them saying, oh, the doctor has reached out because my data was automatically tracked. And today my smartwatch showed that I did not do the work. So now comprehensively, my diet has changed. Comprehensively, my tomorrow's target limit for the number of steps has changed, right? So now your patient feels like you are more involved. And you are able to optimize your, so let's say out of the 5 patients, 4 are sticking to the adherence is there. Whatever you said they are following, and 1 is not following. Your total success pool is not diluted by that 1, because even before the outcomes are achieved, you are able to continuously and proactively say that, hey, look, you are not meeting your targets. And as you do this, who are the main stakeholders who are involved in creating digital health, right? Unfortunately, they are not cool people like the people on this slide. Being a highly traditional industry, being a highly regulated industry, the advantage that India currently has is India has something called the NDHM ecosystem, which is being created by the government itself. And even in larger markets like US or Europe, in US you have HIPAA, which is a governing body for all data, which is a governing act which regulates how data will be captured as well as exchanged digitally. It could be between clinic to clinic, it will be from clinic to an app. So those regulations exist there. And in India also, now there is an initiative where something called the NDHM EBDM ecosystem is being created. And that has multiple stakeholders across multiple partners who are necessary to deliver the health outcomes for the citizens or patients, right? So that includes your policymakers, both on a state and government level. That includes your private hospitals, it includes your public hospitals, it includes your labs, your NABL pharmacies, your wellness centers that offer standardized care. It includes the biggest component of this. It includes TPS and insurers. So the whole idea is, earlier, a lot of large hospitals, today even private hospitals, have the problem that insurance payouts either take a lot of time or there's a lot of back and forth on claims. The whole ecosystem is supposed to accelerate that process and ensure that hospitals get payment on time. And insurers have very clear protocols in place where it becomes very binary for them to say, is this claim going to get approved or not? If so, what is the percentage it will get approved? And have transparency on that data. And the intent to achieve that is by partnering with health tech companies who can comprehensively capture this data point without revealing who the patient is, so that that patient privacy is ensured, right? And they have something called the NDHM EBDM stack. MedPiper is also one of the first integrators in that space. There are tools which today, so we have something called mScribe, we have something called InstaClinic, where even before the patient comes in, if against that patient's phone number, a health ID is generated, you can directly pull in the health ID data. Thereby, you can see that even before the patient has come and sat in front of you, Was he generated a prescription before this? How many days before this? Did he do a diagnostic report? Was a diagnostic report uploaded? Right. So now you have much more access to deeper information and you are able to cross coordinate. So let's say that you have given a recommendation for a patient who's a pre-diabetic, and let's say that there is a medically approved dietitian. You can directly share elements of this without them having to go download and say, this is what my doctor did. You're able to create your own network also across the care journey rather than just sticking. And the value here is that you are unlocking more value for the user. Because today, when a patient thinks about healthcare, they think about it in modular components. I have to go to the doctor, I have to go to the diagnostic lab, I have to go to the dietitian, I have to go to the mental, I have to go to a workout. And all of these are separate cost centers. Right? Over time, especially with insurance, this whole journey now can be covered with insurance, at least some part of it, or possibly as much as possible. Right? And now the cost for the user to adopt other services, it is not about I can only do this or I can only do that. A certain part of it is taken care by insurance, and his overall bill comes down. But at the same time, the individual value creators, you are able to unlock more and more value for the patient at a much lesser cost, because you don't have to tell them to do 10 tests now. You only have to tell them to do 4 tests because you completely understand what their profile is, right? But in these 4 tests, you are still unlocking much more value per user than what you would have unlocked earlier. So now the customer is also going to come back to you. So the next time that patient is not well, he's not going to feel that, oh, that hospital was expensive or that doctor was expensive. All he's going to remember is that that doctor was able to give me comprehensive. It didn't matter that I had to go to a dietitian. It didn't matter I had to go to yoga. He was able to share all the data wherever that was needed. And that was super useful for me. Right. And one of the things that Dr. Rajesh mentioned was impact. Driving, most doctors are clustered in urban centers. So one of the initiatives we have been able to do at MedPiper is we have a tool where if you're an urban doctor and you have some free time, our tool enables any NGO or any, people like communities in Ladakh or communities in Kutch in Gujarat, which are like very distant areas where you will have probably 5 doctors for a 10 square kilometer area, right? There, give out your time and still monetize it. You're not doing it purely as a charity. You are creating value for the money that you make, but at the same time, keeping into consideration the cost of the local market also. Thereby, you're able to drive better impact, you're able to drive better outcomes, and you are keeping yourself engaged also. Right? And by being integrated with NDHM, you don't have the onus of, did you save that patient data right? Was there a security leak? What if tomorrow somebody else gets access to this data? Everything else happens on the software, right? It is the job of the software to ensure that the data regulations are met. And the biggest advantage is you get to do program management. You could be a part of a program management. So what we mean by program management is, let's say that there is a cancer patient, like my father, as I said, was just recovering. And for him, irrespective of the treatment we had at the hospital, we needed to go to a dietitian because there were diet restrictions. We needed to go to a physiotherapist because he was feeling weak and there was certain this one. Now, because across the ecosystem, because everybody's data is talking to each other, the individuals also can start talking to each other. And without having to spend too much time of trying to explain and trying to make them understand, the data is very clear. It captures a lot of points. So now you get to build programs. Okay, do you, if you come for cancer care, if you're come for arthritis, if you come for condition X, Y, Z, it could be autoimmune disorders, it could be dermatological disorders, it could be diabetes, it could be ENT related conditions. You get to create complete programs around it, thereby making that patient feel like, doesn't matter you have come to me at my clinic or doesn't matter you have come to me at a lab. Right? I am able to direct you to the right resources otherwise also, where comprehensively you're complete, as far as you're concerned, since you have come to me, outcomes are being delivered by me as much as by the next person, thereby driving better outcomes and better engagement. So then the question becomes, okay, the product is doing so much. So what exactly is the product? The beauty of it as well as the challenge of it is there is no product. It is an ecosystem, and thereby it is the outcomes that are driven. So the product is the assumption of the user of how good his experience was, right? So if you do doctor online today, the fascinating thing is, for a country the number of searches for doctor online, which is about 7 billion, is higher than the population of the country, right? And only 400 million Indians have smartphones. So you can understand the number of repeat searches that is happening just for a term like doctor online, right? And if you look at, so there are week-to-week breakdowns of the volumes also. Just in last week, you had 49,500 people searching for consult with a doctor online. 49,000 people searching for consult with a doctor online. 49,000 people again searching for doctor online consultation, right? So these are large audiences, which they could be from Tier 1 India, they could be from Tier 2 India, they could be from Tier 3 India. All of them want access to you, right? So how do you ensure that you are visible online, you are able to tap into this demand that is being generated? Because the country is not getting healthier as long as these search volumes are not going to be catered. People are searching, it means that people want to get healthy, right? And you could be a doctor, but even if you have a 20-minute free in your window, there is a possibility that you can drive health outcomes for at least 2 people. And today there are tools that exist which can enable you to do that. And what is eventually going to happen is, so if you notice, one of the things that has happened is, if you see all the search results, that is actually the sad part of this. Today, it's become extremely, as I said, commoditized. So somebody saying, okay, you can talk to a doctor for 200 rupees. Somebody saying, okay, 24/7, you can talk to a doctor, right? But the grateful aspect of this is no person per se is saying, I want to talk to a doctor because I want to talk to a doctor. They want to talk to a doctor because they want to get better. And all aggregators that are making money today, as long as you're not able to drive outcomes, unfortunately, they have positioned themselves in a place where they act as a middle layer, as a wall to getting easier access, rather than enabling, rather than being able to say that doesn't matter, you want to talk to Dr. A, Dr. B, Dr. A is this, Dr. B is this. Let the patient decide and let the patient have those multi-optionality, right? And that is where eventually the whole ecosystem, especially with the NDHM, is going to go. Today, if the question is about where is the consultation today, how much does it cost? That is why you have a search doctor consultation online. They want to do it online, right? Tomorrow the search, and the trend is already there. If you go and look at what people are searching around healthcare on Twitter, what people are searching around healthcare on Quora, what people are talking about on healthcare on Reddit, they are not talking about, I want to take a diagnostic test for 800 rupees or 400 rupees. They are not comparing price at, full body health checkup here is costing 2,000, there it is costing 1,000, where should I do? They are talking about how do I get healthy? They are talking about how do I ensure that at 45, I am still as healthy as I was when I am 30, or I am at a particular state of health at 28 and I want to keep having this for the next 20 years. What do I need to do? People are already doing this. The search is already there. All we have to do is ensure that you are placed to be able to serve this. And the easiest way to do that is adopt the right set of tools, right? And fundamentally, for your role and your career, you are at a place today where you have 2 divergent paths ahead of you. The road today most traveled is a road where most people have become a commodity. The road which is less traveled, but what the future demands, is where you are creating your own, what I would call your digital persona, where you are able to do online what you're doing offline. Offline, you have a captive audience. Offline, you are able to control your, at the end of the day, this is your profession also. This is your bread and butter. You need to earn. You have a family to, take care of. You have personal expenses. You have loans. You have liabilities, right? So you need to also make money. So how do you set your price without, some aggregator or random person coming and saying, no, I think you need to give so much discount, only then I will have. And even then I will demand that you need to be 4 hours on my platform, right? So there are tools more and more as we go ahead. It's already happened with what is called the creator economy. It will also start with the health economy, where people today are looking at transactional elements. And that has been the highest bump. But slowly, gradually, because people are already used to the transactional elements and now understand how that works and have understood that it is commoditized, they are moving away from searching where do I find consultation, to searching for, I have this particular condition, what do I do about it? And if you're able to position yourself in a place where as much as what you do online, which is build networks, set up your own small clinic or be a part of a brand hospital, and they list you, they give you a name board, but you get to be able to set the price in partnership or in share agreement or whatever it is. Similar to that, there are tools today online which already enable you to do it. And even for us, the goal at MedPiper has been to accelerate this movement rather than take a journey where doctors still continue working honestly at wages that don't make sense for them on aggregator platforms, wait them to tire out and get them on that journey. So at MedPiper, primarily, we focused on 3 baskets. We said that, look, there are doctors. It could be students, it could be senior doctors, it could be practitioners. Then there are healthcare organizations, and then there are patients. Eventually, patient wants access to outcomes, and these outcomes can be catered only by doctors and healthcare organizations. So how do we make their life better? And there, fundamentally, it came down to us saying, okay, here are these 3 values that we can build, where we know that if we are able to build this value, we will be in a place where without reducing the take rate or without reducing the income capacity that any of them have, we will still be able to offer a cost which is affordable for the inpatient, right? And to be able to do that, what that means is we need to enable doctors to work smarter. As Dr. Rajesh said, we need the doctors to be able to upskill on the fly. It should not be passive. If you want to know about something, that could be about the latest surgical procedures or the latest advancement in technology, that should be available to you on demand. If you can watch a Italian movie on Netflix, you should be able to watch what is happening, what is the latest thing that is happening in oncology, right? Because that is more important. There is a risk of fatality there, right? And as you do this, how do we ensure that you are able to build your own brand and network where you are known for what you do? You are known for the fact that you work smarter, and you are known for the fact that you are one of the best at what you do. How do we ensure that? So that was our primary challenge with doctors. And how do we solve for doctors? With healthcare organizations, one of the key things that we identified was, as all this data comes, the hiccup is still that a lot of insurance payouts either don't happen on time. There's a lot of random reasons why claims get rejected or only part claims come through. And it eventually comes down to saying, is the data cleanly captured, right? Do we have more data of why the doctor said XYZ? And that goes back to saying richer patient data, right? And because if insurance is there, is a healthcare organization able to streamline the ops? Are they able to have predictive analysis of footfall versus business partnership driven volumes that is coming in? Thereby, where they're able to say that, look, we have invested a lot of money in assets. We have invested a lot in hiring very smart doctors, but we need to have so much gross margin, or else there's no point in doing a hospital or a clinic as a for-profit venture, right? So ensure that they have the right set of tools where we don't interfere in any areas, but all we help you is get more efficient, get more transparency, and thereby spend less and get the money that you are supposed to get paid faster. And for the patients, all of this eventually what ends up to leading is faster path to care outcomes, better clarity on what is happening with them as a part of the care journey. And once they understand what is happening to them, once they feel that, yes, this is... So one of the interesting things that we recently noticed, because I have to quote an example here, is in an osteoporosis care journey for a particular pharma company, they have a particular drug, and that drug takes 6 months to show outcomes. But because in this 6 months, people are still in pain, by month 2 or end of month 3, the patient comes back and says, this medicine is not working, put me on something else, right? Whereas very early on itself, they were informed that this will take 6 months. What we were able to go and do is we were able to tell the doctors that, why don't you offer as a part of this, because they're going to be there for 6 months anyway with that particular drug, why don't you use one of our tools called Insta Clinic? And as a part of this, at the end of every month, give them a diagnostic test, right? So what happened is about 40% of the patients stopped dropping off on month 3, because now end of every month they were getting a diagnostic report that was telling them you're actually getting better. Earlier, their reason for dropping off was a feeling that they had that I am probably not getting better. Now there was clear data indicating that yes, certain components of your health is getting better. Thereby, they were able to adhere to the care protocol. And now the doctor had much better success on even not just on paper, but with respect to the patients. The referrals, as it is, were good. Now he was getting in more referrals than he could handle, right? And eventually what this ended up happening is you reduce the cost because the patient is still on the same care protocol, right? And you are able to drive efficiency there because now you understand where patients tend to drop off. Now you understand them better and deeper. And if you are getting active, this is something that I will skip for now. This is not too relevant. And yeah, so as I said, who's involved, what's entailed, and who's the best channel is something that you as a doctor, are you a doctor sitting at a clinic? Are you a doctor who's a part of a larger hospital? Are you a doctor who's also helping out a diagnostic lab with respect to the reports? Depending on where you are, we at MedPiper have certain tools which you already built out. So it doesn't matter if you're at the very beginning of your career, if you're just finishing your medical school, we have a free resume builder tool. And you can build out your, we've generally seen that a lot of doctors don't get a lot of good, clear advice on how to build your resume, right? So we have a free resume builder tool. It's on our website. You can just go out and build your own detailed resumes. The advantage is once your resume is created, it's created for perpetuity. So you can come and download it later. Also, you can just update it as and how you see fit. And we have a tool called MConnect which will enable you to connect yourself into multiple locum opportunities, both offline as well as into multiple virtual health platforms, where you get to decide your price. That I will do a virtual consultation today, doesn't matter if from Tata 1mg or MFine or DocSab, but only if that consultation pays me more than 200 rupees or more than 300 rupees. If it's less than that, I don't want to do it. You're able to set in that price on your own. HCP wire is something where we enable diagnostic labs as a part of our insurance bundle. So when a person comes with an insurance and the doctors told them to go get it, the HCP wire enables the diagnostic lab to do two things. One is manage that data much more efficiently, as well as if they want to drive referral to a doctor, they can directly do it within the tool itself. MScribe is a free prescription tool which actually gives out patient insights on the next call to actions. And InstaClinic is a tool where we enable you build out your own website, and it happens in a matter of 3 clicks. So you have what a practice is probably selling you for anywhere from, I don't know what the prices currently are, but 1,000 or 2,000 or even 10,000 rupees what you pay monthly or quarterly. You get to build out your own website, and you get to have your own calendar. You get to set your own price, and the customer data stays with you, and you get to have your own engagement. At no point is that data coming to MedPiper, or at no point is MedPiper trying to set the price for you. And the goal that we have is, as we have more and more doctors using this, we plug you into partnerships and integration. So today, a lot of health insurance doesn't have cashless OPD, but we have been able to work with some insurance players today to give cashless OPD. And that is by directly partnering with doctors who are on our platform. So that doctors are already pre-vetted, pre-attested, and insurance companies knows that, okay, if it is from them, then it will be cashless, right? There are health platforms in the US that provide second consultation. We have been able to, they could be a Shopify store or whatever it is. We can give them API and SDK where Indian doctors are available for second consultation, thereby expanding the scope of your reach. We work with NGOs in India, where NGOs run what is called a telehealth booth. And in that telehealth booth, doesn't matter that the NGO is servicing in Assam, you could be sitting out of Trivandrum, and you could still do that consultation. You could give service there, right? And as you do more and more expansion, you have better opportunities to build your own brand and monetize, and thereby grow as a doctor, as well as grow as a practice, right? And by doing all this, standardized data is there, standardized workflow is there, and we unlock more value creation for the doctors themselves, as well as for the patients. As I said, these are primarily the 3 tools that we have in the market: MScribe, HCP Wire, and InstaClinic. MScribe is for practitioners, which is both your, so you could be running your own clinic or you could be running your own practice. It's a free patient management plus prescription tool. There's absolutely no cost to it. HCP Wire is something that's uniquely for diagnostic labs only, and InstaClinic again is a free tool. You get to create your own brand page. You get to send it to the patients who are already engaging with you. And at no point is MedPiper coming and trying to dictate that order medicines or do XYZ. It's just your own digital clinic, and you have complete ownership of it. And Soumya is already on the call. She's our market lead, and she'll be, if any of you have any questions, I'll open for Q&A right now. Hello. Soumya? Soumya, voice is breaking. There are a few questions in Q&A. I'll just take them in order. The first is digital transformation is very useful in healthcare in urban. It needs minimum education and knowledge. What about rural and illiterate population? The whole assumption that for digital health to work, you need literate audience is itself broken, right? When I said 400 people in India have smartphones, that includes urban and rural. People in India today know how to use WhatsApp, even in the rural centers. And in areas where even WhatsApp doesn't exist, one of the things we have been able to do is work with ASHA workers locally. So for a whole cluster of, let's say, 50 houses in a locality, if there is one ASHA worker, that ASHA worker on their smartphone can be enabled with better access. So they become the go-to worker for health needs. And for the doctors or for the other ecosystem stakeholders, it's one point of access now, right? So there is always a way to enable the tools, right? Digital health isn't just about saying, can they do an audio consultation or a video consultation? It's about saying, is a diagnostic test report readable? Was there a call to action on the next item to be done there on it? And was that captured? And was it communicated to the end patient? So I hope that answers your question. Knowledge and education isn't actually a barrier. The whole advantage of digital health is if digital health can be implemented in its full scope, it should be able to reach anybody irrespective of who they are, where they are, what their degree is, or what their age is. The second question is by Kavin T. India has been success in digital payments. Will it be success in digital health, sir? It's a long vision. How can you throw some lights about government initiatives for digitization in health industry? So health and insurance are two sectors where all cutting edge technology is actually driven due to government push. And that's not just for Asia. Even in US today, you have much very advanced, be it UK, you have, be it Europe, be it Australia, be it Japan, you have very advanced healthcare systems because the government pushed for it, right? And there the whole NDHM and ABDM initiatives are very strong initiatives. Since we are a part of the early stakeholders who are also building out the stack, some of the technology that they have a roadmap for, see, it is going to take time. Because one of the disadvantages of working in a large country like India is even for the simple fact that you're putting a WhatsApp chatbot out there, you need to support at least a bare minimum of 30 languages to be able to say that I cater to so many states, right? So the challenges are there, but the whole idea is where can we capture a common layer and thereby build over it? So how will it succeed play out over the next 5 years? We don't know, in short. But what we know is there are multiple attack vectors which are being tried out. So ABDM is for diagnostic labs. There is standardization in terms of health ID for the health data that is getting generated. And it is being mandated that you have to integrate into it. There is standardization with regards to health insurance and life insurance, where they have said that policies have to be standardized. So multiple initiatives are being tried out. And because there are multiple initiatives on scale, the idea is government will be able to, similar to you have UPI for payments, we can hopefully have what is called UHI, Unified Health Interface, for health services in India. The third third question is again by Anonymous. What data is being collected on doctors and patients through your platforms? How are you protecting your data? In terms of data regulations, the most strictest data regulation in the world currently that exists in the US. It is called HIPAA. And the reason that came into existence was in US, as people go from health insurer A to health insurer B, how like they started off there, but what it ended up becoming is one of the most robust systems of data protection around the consumer data in healthcare. On our platform, from the doctor side, it is very important for us that as a doctor, you are able to say that you are verified, because let's say that I don't know who posted this question. Let's say that there's me and there's Soumya, right? Between me and Soumya, all my antecedents might look right, but we also need it verified. So the platform, the success of not just you as a user, but everybody else on the platform also, that is something called network effect in technology. Even if I have 10 bad apples in a pool of 10,000, that is enough to have a negative impact on everybody in that network, right? So from the doctor side, we purely stick to your professional data. Nobody from MedPiper ever receives any marketing emails. Nobody gets any spam calls. Those kind of things we have been very aggressive about. We have a very strong network in India today, close to about 80,000 doctors. And we can confidently tell you that not even one doctor would have received a spam call, right? So there have been pharma companies that have reached out to us and asked, can you expose data? Can you do some marketing? We have said no to it. With regards to what patient data goes through a platform, there are very strict. So as I said, we are one of the early integrators for NDHM. There are very strict protocols in India also now. And we are actually helping the government frame them also in terms to, so between, without patient consent, actually no data flows from point A to point B. The patient consent is the most important thing. Again, with consent, we don't share enough data where somebody can triangulate and uniquely say. The doctor gets ownership of his patient, but beyond that, would the diagnostic lab have it? Would the shop that sold him medicines have it? No, they won't have it. Then there is a question by Dr. K.M. Abdullah. Is there any mechanism to give training to doctors in Kerala? My awareness here might be a little not up to date, but recently there has been some update from National Health Authority on teaching hospitals being able to impart direct. So there's a lot of new things that are being tried out. Definitely what has played out or what is not playing out, because we also have the confusion of these overseas return doctors, what is happening. So there's a little bit of juggling that is happening in terms of saying there's a lot of things in the air. Should this be done? Should that be not done? Should virtual education even be allowed for doctors? If so, how would that play out? How would you have sharing of credit points between states? There's a lot of nuances to medical education because every state has its own format and structure. Every state has its own license board. I am not the best equipped to answer this question. So that is why we also stick our education programs primarily to, similar to ISA, your local body run CME programs is something we know that there is no question of ambiguity. And we are comfortable with enabling that today. Then there is a question by Dr. Atul Bhargava. Please suggest a basic tool or format which can identify the real requirement of healthcare organization in terms of using. Dr. Atul, that question is a little vague. I don't understand by healthcare organization, do you mean a clinic or do you mean a hospital or do you mean like an insurance company? And is a problem to solve for bookings or patient, or is a problem to solve for saying we want to be able to serve the customers better in terms of the data we have access to? If you're on the call, you can, if you're on the Zoom, you can just unmute yourself and fill in those bits. Okay.
Nitin, there are few questions in the chat also.
Yeah, I've just opened up the chat. First is steps to improve digital transformation in a local hospital. Every hospital, see, today hospitals have spent 5 or 6 years at least trying to say, no, every 2 days or 3 days, somebody is walking in with a new booking system. Every 2 days or 3 days, somebody is walking with some app that gets you more patients or do XYZ. As a hospital administrator or hospital manager, or the MD of a hospital or a clinic owner, you understand your hospital the best. And the approach to taking digital transformation is to drive, where do you think it will drive the most impact for you in terms of value? So that value could either be a cost value in terms of improving your gross margins. That value could be an work efficiency value in terms of saying that I am able to manage my operations better. Or that value could be in terms of your cash flow, in terms of saying I can have better ways of tracking my insurance payments are delayed, or I am not even a part of the insurance network. I can get onto the network. There are tools, honestly, today for everything, right? But do not a lot of these tools also come and try to oversell the promise of what they do. If you have a clear identification that, see, because I met a few hospital people, they have a footfall of 20, 30, 40, and then they ended up paying a very expensive, signing up for a very expensive tool for a booking management system. And after 1 year, the whole management's approach towards anything in digital was like, oh no, it is waste. But then you sit deeper with them and you understand, you realize that they ended up spending 20 lakhs on a product which they could have anyway managed with 2 people. They didn't even need to have a software for it, right? So where are you placed? What is your most pressing problems? I would ideally recommend that always ask for a free demo, right? And at the beginning of the demo itself for the tool, establish your success metric. If a tool is coming and telling you that we will give you more patients, ask those right set of questions of saying, okay, give me a demo for a week. Since you're driving more patients, even a week is a good time to know. Now, in that week, how many new patients will you give? How much, what is the kind of transactions I can expect, right? What would the profile of these patients like? It could be a software that says that we will help you manage better facility management in a large hospital, right? Then what is the statistical improvement that I want? Like I have 15 people, will I be able to reduce it to 10 people? Or I have, today I have a requirement to spend X amount on facility management, will that get improved, right? Or my cost of procurement for facility management is X, will that reduce by, so much percentage? There are enough tools. Be very specific in your ask, be very targeted, and then establish your own measure of success. That is the simplest way for you, because or else it is also very easy to overcomplicate. Oh, we give you this, but we also give you that, but we also, the reason we also have 3 different products. MScribe is like, there have been people who have come to us and said, you know what, we want all 3. So why don't you club all 3? All 3 solve for very different problems, right? InstaClinic is about your digital brand. You have your own website. You have your own Google business page. That is what we enable to you with InstaClinic. So when somebody searches in your locality for the offering that you give, your page comes up. And we don't set the price, you set the price. For me to club that with a digital prescription tool absolutely makes no sense. Because one is a decision maker I am catering to is a owner of the clinic. I mean, of course, you can be the same person. You can be the same doctor who's running the clinic. You can be the same person who is talking to the patient. But the way you measure success is very different. So it is much more easier when you're very clear of what purpose needs to be, each needs to solve for. And eventually all that should matter to is, are these systems talking to each other, where my life is simpler. So it doesn't matter a patient came through InstaClinic, I was able to cater their consultation on MScribe, and eventually when they want to do a follow-up, they're able to come back on InstaClinic. Does that loop exist? And for me, from a cost benefit, does that loop make sense for me to pay what I am paying? Am I making ROI? So if I'm spending 1,000 rupees on a tool, is that tool enabling me unlock another at least 5,000 or 10,000 in value? If the answer to that is yes, then those tools are made for you. If the answers for that is no, don't buy those tools. Simple as that. And what is the future of telemedicine? So telemedicine is going to be extremely commoditized as a standalone entity. And where telemedicine will actually pick up is as a part of the care journey. It doesn't matter if I have a flu, or it doesn't matter if I'm looking at a diabetes. Telemedicine is going to be more like the commodity entity of saying it is going to become a channel. It is like asking, what is the future of chat? There is WhatsApp, there is Telegram, there is Messenger. Right? The whole point is driving that communication. Telemedicine is a step in a process to the patient engaging with you. So the future of telemedicine, we are already like, there is very small iterations that you can build in now into the product. So today the question is more about, over and about telemedicine, what else can be enabled, right? And that is where this whole digital health ecosystem comes into play. And yeah, again, there's a question on digital transformation. So in digital transformation, start with what is your immediate need. It could come from your P&L statement. It could come from your marketing team. It could come from your sales team. It could come from your floor management team. But try to start with problems that you actually want address for. And then there are like, we can help you. There are tools that, so we partner. So MedPiper, as much as we build our tools, we are the strongest with regards to partnerships and integrations, right? So we will be able to also, so one of the founders, he was a part of Ernst & Young. He was an IT architect, where it is something called consultative advisory. So they used to advise large hospitals like Leelavati, like AIMS, on how to implement digital transformation in a hospital. And that used to be for the hub hospital and spoke hospital. So he's worked with close to about 500 hospitals across India, including the larger chains like Fortis Manipal, and very smaller niche ones that do purely fertility or do purely bariatric. So we'd be happy to anytime help you with, even if it's not our own tools, who are the other tool makers in the market. Because it is, as I said, very consultative. We need to sit with you and understand where do you think that you need that transformation to happen. Because you could end up in a situation where you're paid for digital, but you have zero transformation. And that is a worst place to be in, because unfortunately, you will be creating a bias against technology or future technology. Okay, Dr. Atul Bhargava has mentioned hospital. Yeah, same answer, Dr. Atul. Look at, do you want to improve your predictive system for footfall? Do you want to improve your insurance payout funnel? Do you want to enable a checklist for a patient who comes that, okay, step, this is what you take. So do you want to give them like a WhatsApp bot, right? It's a purely consultative process, because every hospital is unique, because every set of local audience in India is unique. Every 100 kilometers, India has a different set of audience. The age condition changes, the health condition changes, the paying capacity changes, the social economic factors change, the kind of food changes, right? So for every 100 kilometers, two same set of hospitals can be extremely different. I think that's all the questions that we have. Any other questions? Soumya?
Yeah, I was just checking maybe if we have left any questions. Even also you have mentioned about the telemedicine part as well, because couple of questions is related to like what will be the future of telemedicine or telehealth. Would you like to highlight?
Telehealth is very different from telemedicine. Telemedicine, as the word says, is about how do you use technology, or, today there is no tele actually in that. It is digital medicine and digital health, right? You don't call up on an old dial phone, or you don't punch in a few numbers. But what is considered as telemedicine is the fact that I can talk to a Dr. A and then I can get a prescription fulfilled. Today, as I said, it is extremely commoditized. And the smarter now, it is so commoditized that doctors actually have an opportunity to be able to go and build their own social profiles. So as I said, like the free tool that we have called InstaClinic, you just sign up on InstaClinic. Tomorrow, let's say that your name is Nitin, you get to create instaclinic.nitin.com, send it out to all your patients. And now there is nobody between, there is no aggregator platform between you and your patient. You can directly talk to them. You can open up your calendar, set up your calendar slots, enable them to directly talk at the price point that you are putting for return patients or new patients. And we bring in the network where it doesn't matter if the person in Ahmedabad or he's in Amravati or he is in some other place. The diagnostic partners will be within the network. So the patient at the convenience of his home can now talk to you, whom he already trusts, and still get services which is not related to you. But for him, it feels that, yes, Dr. Nitin has given to me, and now I will continue using it. With regards to telehealth, the future is always going to be about getting personalized, coherent care journeys. And until we get there, there is going to be evolution of products, evolution of services. Right? The advantage of digital is that you're able to personalize it. Like, even if you look at the evolution of internet, first there were Yahoo and those kind of discovery pages. Then you had the advent of e-commerce and then social media, where you could create your own personal brand identity, right? The next degree of is going to be about consumption, where I, as a user, it could be about my health, it could be about my food, it could be about fashion, get things. So that is the whole sales pitch of Metaverse also, that you get to create your own identity and then engage on transactions or marketplace elements which are unique to you. That is the same thing that is going to happen with telehealth.
Okay, thank you, Nitin. And let's take up the last question for the day. So how can digital health be improved?
So as I said, if digital health is all going to be about personalized care, then the improvement is going to come in being able to say that people who are delivering the service, that is doctors, hospitals, diagnostic labs, pharma companies, getting access to be in a position to be able to say that if this is how the requirement is coming, we are well equipped to deal with it and standardize it. So if you're able to have that continuous experience of saying it doesn't matter. So there is a word they use in tech, click to motor. So if you're able to give that click to motor experience, what click to motor means is I might have clicked on you as a doctor for an online consultation, but when I require a diagnostic walk-in, or even if I want to do a face-to-face consultation, you are able to recommend it to me without having to spend 20 minutes to understand that requirement, right? So that is where the future evolution is going to look like, where the right set of tools that enable you capture more. What is going to happen with capturing more data, you will have what is called a lot of noise, right? There is a difference between knowing did a patient do 10,000 steps versus knowing did that patient go to a cult fit gym or he went to this other gym. So that analytics is more important than data, and tools that help you analyze is going to be the future of it, not just give you raw data.
Thank you, Nitin. I think we can wind up the today's session. So Dr. Ashwin, over to you.
So thank you, Nitin, for the wonderful presentation that you have done in the last 45 minutes. I think you have given a fair assessment of the developing ecosystem in healthcare that we doctors has to be aware of, something which I personally, at least a couple of months back before moving to Boston, I was not much keenly aware of. Right now, since 1 year, since 1 month, I've been in the US. I'm also getting a lot familiarized with telehealth, telemedicine, etc. So definitely in India and especially in Kerala, where we practice, where I used to practice 2 months back, we are decades. We have decades more to go in that setup. So Nitin, you did a wonderful job in sharing that information, and where are we going and what we have to do and how much more we have to do. I'm really happy that there are innovators like you who are actually acting as intermediary between people. I mean, our patients are our bread and butter. We should not forget that. And intermediary, so that the ecosystem of the service provided by us can have benefit not only just a person but a lot of people. So definitely we need more thoughts, more topics, and more understanding regarding this. So yeah. I always thank IRA in coordinating all these sessions, much more than I would personally put them as extra academic sessions, which we dearly need, not only just about our specialty, which is radiology, these kind of talks, which is increasing our awareness of the newer nuance which we are facing. So thank you. I would like to thank MedPiper for hosting this session. It is absolutely informative, and I'm glad we are having an association with MedPiper. And I look forward to continue much more interesting lectures. So that is it for this night. Hoping you guys come and join us for tomorrow's session.
Thank you, Dr. Ashwin. Thank you, Hayari.